Welcome to Thursday Thought Leaders with Harbinder Narula on BW HealthcareWorld. Today's conversation sits at the intersection of the global trade diplomacy and India's MedTech ambition. As India deepens the free trade agreements with the UK and the EFTA bloc, the country's medical device industry is poised for a transformative decade, targeting a projected 50 billion milestone by 2030. But trade agreements do not create exports. Ecosystems do, networks do, and infrastructure does. Now, to explore how global trade policy translates into a tangible market access, we're joined by two leaders shaping this bridge between India and the world. Scott Wang, the Vice President of Asia Pacific for World Trade Centers Association, also known as WTCA, representing a network spanning 300 plus cities across nearly 100 countries. Joining Scott and me is Dr. Jitendra Sharma, who's the founder and the managing director of Andhra Pradesh MedTech Zone, better known as AMTZ, one of the world's most integrated medical device manufacturing ecosystem. This discussion about moving from agreements to action and from policy to production is going to be a really meaningful one. So I welcome all of you to BW Healthcare World's Thursday Thought Leaders with Scott Wang and Dr. Jitendra Sharma. Welcome, Scott, and welcome, Dr. Jitendra Sharma to BW Healthcare World. Scott, let me ask you my first question. India's FTAs with the UK and EFTA bloc are being described as a turning point for the medtech exports, right? From WTCA's global vantage point, how do you see India being positioned in the current global medical device supply chain realignment?
Well, thank you for this wonderful opportunity. I'm so glad to see Dr. Sharma again because we met last week. He actually showed me a new component of the ecosystem at a university. I was very excited. So the question, yes, I think there was quite a lot of exciting news from India regarding FTA. There's several FTA, actually, most recently also the FTA with the EU, and also a trade framework with the United States. I truly believe that will pave way for further facilitation between of the trade between the two sides. So in all these FTAs, I think their farmer MedTech is a part of the major beneficiary of these agreements. In my memory, I do not see a major economy entered into so many major FTAs with their major trading partners in such a short period of time. So this is a major achievement. I wanted to congratulate on India. To me, these agreements, it's tariff is one thing, but it's probably more important is the non-tariff barrier. These things are typically the major roadblock for India, but MedTech products to access these major markets, such as the EU and the United States. Their progress achieved in non-barrier, and I think Dr. Sharma is very much they're one of the top experts on these details. That means a lot. For example, the standardization, the market compliance, their supply chain integration, the partnership development, all sort of things, and certification. How that India can align their development with the standards in these countries through agreement. I think this is a major achievement for
Awesome.
sure.
And Dr. Sharma, FTA is one thing, opening of an opportunity is another. But do you believe that Indian manufacturers are operationally ready to respond to this opportunity, or is there still a capability gap that exists?
Thank you for having me in this conversation with a very dear friend, Scott, and you, Mr. Narula. We have had few very interesting conversations in the past. Look, India has signed, and this I am saying as a trustee of India Brand Equity Foundation, which is a trust of Ministry of Commerce, Government of India, which is actually signing the FTA. Last 1.5 years, as Mr. Scott rightly mentioned, India has signed FTA with UK, Australia, 3 Middle East countries, entire European Union, and a solid trade framework leading to a concrete FTA with US. What does that mean? It means an opportunity which has 2 sides. One side are the manufacturers who are to some extent ready, to some extent semi-ready, and to some extent they need to quickly identify the gap that exists in good quality component value chain to serve FTA markets. In that journey of gap identification and jump, an orbital shift, that's exactly what World Trade Center Association actually helps them do. Because they, in WTCA family, are connected with 300 plus World Trade Centers, where they have the unique opportunity to look at gaps and who can fill that gap so that they can serve the FTA market. And therefore, a large number of manufacturers in various sectors are ready. Some are ready in quality of product, but not in processes. So for example, if you look at food packaging, the number of processes that EU may follow may be very different in terms of traceability to what India follows today. So they have to put their documentation, quality management system processes in place. And to some extent, they are not ready because they need to identify the skill gap because technology is evolving. Many manufacturing processes have automation, and these are the gaps they need to fill in. But that's only one side of the coin, which leads to market access. The second side of the coin is the ability of these FTAs with more than 90% of the world to bring in foreign direct investment for future manufacturing. Given that tariff barriers are off the table, the attractiveness of India as a destination to attract manufacturing giants for future market access is the second piece of opportunity, the second side of the coin, which may not be visible today, but it has humongous impact tomorrow.
And Dr. Sharma, when an FTA is signed, at the ground level, at a very basic level, what do you think actually changes for the manufacturer who sits inside AMTZ? What are the practical implications on compliance, on sourcing, and the export strategy for this manufacturer who's a part and a member of AMTZ?
Yes, not just AMTZ, but an environment in the shop floor of any manufacturer. FTA or without FTA is different in 4 parts. So if you just look at a circle and divide it into 4 parts, if FTA starts tomorrow with a country, 4 things happen. Number 1, great deal of documentation in terms of quality management system and accreditation of the manufacturing facility. Because then your potential customers would ask for it, ask for those certification. So that's one check mark that happens. The second thing that happens is that you need to take your product for product certifications as desired by the customers in the FTA destination. That could be A2LA, ASCA, PMDA in Japan, TGA in Australia, CE in Europe, ASCA and A2LA labs in the US, leading to FDA. A whole lot of certifications of the product. So you need to be ready and take your products towards those certifications. The third thing that happens is the manufacturer immediately leashes on a great business development and marketing team in the FTA destination to get you orders. Because if orders don't come, then you don't take advantage of it. And the fourth thing that happens is that now you are tending to be an exporter to an FTA destination. So you need to calibrate financially your taxes, GST input credit, and all that you file to the government. So you need to balance how you would take advantage of the taxation benefit and the export benefit that the customs would bring in now that there are no taxes or not very high taxes. So you calibrate your financial strategy. So quality strategy, product certification strategy, marketing strategy, and financial recalibration strategy. These are four things that happen on any shop floor or any CEO's office.
Fantastic. I think, this is a great step towards pushing them to be globally ready and be at par with every other manufacturers in the world. Now, Scott, how does WTCA help ensure that the policy level advantages that we see through this agreement that has happened convert into buyer discovery and real commercial partnerships? Because at the end of the day, that's what everybody is looking at.
Well, first of all, the World Trade Centers Association, we're a non-political, non-for-profit organization. We do not directly get into FTA discussion, such as like between government. But we the good thing with our network and what we can contribute is that by connect the region and business community. In this case, we go back to today's topic, the MedTech community with our global trade ecosystem. Which the central part of this ecosystem is our global connectivity, connect with more than 300 major cities, trade hubs, through our WTC, and also collectively we serve millions of companies around the world, right? I think this current the FTA we're under discussion. It probably covers about India, except India. It's the US market, the EU market, including the UK, probably covers 1/3 of our global network. So in each of these major cities that has a World Trade Center operation, that we have a local team, local access, local expertise to help a company in this industry to connect with a partner, to gain insight of market intelligence, to form partnership with even with regulators. These are all super important things, resources. We can work together with our partnership members, World Trade Centers, to really deliver to companies. For example, when Dr. Sharma was talking about some of the things that could happen for local manufacturers and companies, and we all know there might be some of the gap, right, between FTA and some of the real programs or mechanism that can really transform companies in their market access ready, FTA ready type of operation, right? So they need not only company need to put a lot of efforts, but our members, our World Trade Center operation can play a major role for example, to collect market intelligence, to collect regulation information, to put together, for example, corporate training program to coach these manufacturers. I do think that Dr. Sharma, do you have that kind of component ready? Because the university itself is a huge education resource for this type of purpose. And there's a university or that kind of education institution inside a industrial park is a very, very a big deal. I mean, that this ecosystem can need to have to make that FTA benefits concrete and tangible for companies.
That's fantastic, Scott. I mean, it is good to see that, there are structural advantages that FTAs unlock for the Indian exporters of MedTech, especially when we're looking at a sector which is relatively more regulated than the other sectors. Dr. Sharma, how do you think AMTZ is helping align or helping the companies in the MedTech zone align with global regulatory standards like CE making or marking or MDR to fully leverage the advantage that this relationship now brings to the table?
Yeah, so very simply put, a very complex question. Look, CE doesn't happen as a single stage process. No product certification is a single step process. What actually happens first is that you have product standards. These product standards are in India by Bureau of Indian Standards, in European Union by CE, and these product standards needs to be harmonized first. Then the product is sent to an accredited laboratory where you can test whether the product complies to these standards. Those laboratories have their own quality management system and they need to be harmonized. So a lab in AMTZ and a lab in Germany needs to have the same systems of accreditation, and that's called harmonization. Only then this product can go to the lab. Now let's assume the lab confirms that the product tested in the harmonized lab meets the harmonized standards which are specified. This product now then needs to get manufactured in a factory. The factory needs to have a globally harmonized standard. That's ISO 13485, for example, medical device. This is same, universal. So this certified complied product, not certified product, standards compliant product in a certified laboratory goes to a ISO certified factory for production. And then the design master file of this product with production records, lab records, standards are sent to certification agencies, whether it is CDSCO in India or US FDA in US, anywhere, or CE in Europe, for certification using a local representative. Now just imagine in this complex value chain, even if you are tick, 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 tick everywhere, and you don't find a decent or a harmonized or a matching local representative, your process is gone. That's the gap WTC fills up for us and should fill up for anyone. Because it's like a huge house that has an entrance room which is smaller, which has a door which is smaller, which has a key which is even much smaller. But a 2-inch key opens a huge house, right? And that local representative actually needs to file for all these certifications to get the CE or US FDA compliant certification. And that local representative, where would we search if not for agencies like WTCA?
Yeah.
And therefore, it's a bridge between technology and business. And both together takes us forward.
No, that's fantastic. I mean, how you explained that how or what makes WTC and AMTZ a global integrated ecosystem and not just an extended cluster of manufacturing. Now, Scott, from WTCA's global perspective, how important do you think is for clusters like AMTZ to be embedded in the international trade networks like yours?
Well, that's a very good question. When last time I was in AMTZ and we have this roundtable, actually we talked about a dual ecosystem when we had this discussion with the business community. The idea is that Dr. Sharma has AMTZ has its own ecosystem, which we all experienced and impressed, right? With all from the very much concept stage to the product stage, and also he was providing a lot of market access kind of assistance, right? And we have our WTCA have our ecosystem, which is essentially the global connectivity, the facility, trade facility, the integrated trade services, and the major one of the best brand in commercial business. So if you combine the two together, that you have this something in the cloud, like we said today in IT industry, right? Which is our global network, which can, as Dr. Sharma mentioned, which can actually connect you from, for example, industry park in India to the best resource available in your destination market. For example, in UK. Where we have our Washington operation, they know the best about who can deliver the best that the local company in India is looking for. And when Dr. Sharma was talking about the ISO for all these process and the details, I was like just amazed beauty. That's a great combination of the expertise, the local knowledge, industry expertise, and our trade expertise. Business expertise. We together can do so many things to get, make so many things happen for companies.
Scott, I'm so glad that you brought this up because, when you look at the manufacturers of medical equipment in India, we are still using a lot of components that we import from the other countries, which go as a part of the manufacturing of end equipment. What is the value proposition from your perspective for a global OEM and component suppliers to set up or partner within AMTZ to leverage India for the FTA-led exports? This is a huge opportunity for a manufacturer in India to serve the global economy, but we're still using components. I mean, Dr. Sharma, correct me if I go wrong, but we saw that as an example when there's a MRI manufacturing machine that use magnets, and how it has brought efficiency in reducing the manufacturing cycle and delivery cycle so that we can make it more efficient in the ecosystem. So what is your perspective on OEMs that could come in and set up as a part of AMTZ?
I fully agree that this is a huge opportunity for invest and set up OEM manufacturer to really leverage this supply chain opportunity that brought tremendously by their free trade agreement. It's like open the door. But on the same time, I think it's we were talking with the India friends. We're a lot talking about some of their investment environment, some of the business climate in India, which is improving day by day. So I'll go back to some of the Dr. Sharma's points. Let's try to really create a great ecosystem, from government policy, from their micro integration in AMTZ, like such as in AMTZ, to be ready for this investment from overseas it's like make it inviting, make it appealing. So there are things that we can all work together from WTCA's perspective, because we have been in all so many developing countries. We know where the challenge is, and we know what some of the resources that can really help streamline the process. This is something we can really work together for that. In summary, I agree. This is a great opportunity for these companies to invest and create OEM manufacturing operation. But there is areas that we all need to work together to improve, to make it happen.
So, Dr. Sharma, what do you think could be a value proposition for a global OEM to become a part of AMTZ in India?
So one, the value proposition would be the same that would be applicable to anybody, because one of the principles of an ecosystem, it is same and fair to all. You can't have special attention towards one vis-a-vis another, because it leads to dissatisfaction and disparity of benefits. So the value proposition would be the same. I have an example. We have the entire radiology market in the world uses the CT scan, cath lab, C-arm, mammography. We all use something called a detector made of amorphous silicon, and it's coated as a backward integration process using cesium iodide. So it's actually a silicon detector that actually helps us capture the radiological image. There are 4 companies in the world that make it. That's all. Now, one of the largest in the world, Varex Imaging from Salt Lake City in the US, they are at AMTZ producing detectors. From the day they started excavation till the day they commissioned their plant and started producing, we took only 296 days. It's recorded. 296 days from a land and a hole in the land to a product in the hand. Now they are expanding. Obviously, as an OEM, they would not only serve many radiological companies in the world, but also help other OEMs come here. But I think the real opportunity, and this is where I tend to always give an example to convey my point. Look, when you go to an office, you wear office shoes, you wear leather shoes. But when you go for trekking, you wear sport shoes, canvas shoes. You don't wear leather shoes and go trekking. Sometimes the business environment gets complex for reasons that are geopolitical, economic, and not in control of everyone. Sadly, under such situations, we don't change our weapons, we don't change our tools. We keep using the same tool. WTCA gives us that additional cushioning, that additional tool that we can use when things go tougher. And I'll give you an example. Rare earth supply would get more and more controlled, calibrated, and manipulated. Whether it is India, China, Taiwan, Israel, US, Canada, South Africa, rare earth will become a problem more and more, without which most of the medical technologies, electronics can't be made. Now, within WTCA family, there would be many people dealing with rare earth, from mining sector, from metallurgy, from medical, many people. Imagine a small working group of rare earth within the WTCA members, a rare earth interest group, that actually becomes those trekking shoes. Things go tougher, we change our shoes. Countries don't cooperate, members cooperate. And by that small cooperation within a large family like World Trade Center, we make the world better. We give an answer to the world with a positive approach. So to me, World Trade Center is a great family where you can experiment and bring out new tools when your traditional tools are not working under changed circumstances. Scott, please correct me if I'm going wrong.
Oh, I think you hit the point that this is really, you talked about inclusiveness and the diversification of the business community that we're serving. It's absolutely a family, and family members work together. We have different expertise, with different kind of inputs in terms of technology, in terms of knowledge, in terms of talents, from all different kind of industries and different kind of fields, and that could all work together as a single ecosystem to be helpful for companies in India for supply chain here, for sure.
And I love, Dr. Sharma, the way you put in the words and, rhyme it really well. When you say that, when from the hole in the land to a product in hand, or when the countries do not cooperate, the members cooperate. I just love the way you put it across. But Scott, let me come to a very important aspect, which often gets missed when we are talking strategic agreements. Apart from large organizations or wealthy organizations that are a part of the, SEZ or AMTZ, MSMEs, which is the small manufacturer, these companies, apart from these, there are startups that are also a part of this network, And when these small companies, startups, are entering a regulated Western market, the risk for them is very high, because what may seem like a small amount of money could be really, really big, impactful money for them, financially and even operationally. Now, how do you think that WTCs globally act as a soft landing platforms for these small companies that are looking to create an impact through innovations that they are working towards?
Yeah, thank you. First of all, the WTC global family, we work with companies of all size. We work with major companies. We work with very small companies like a startup, or even earlier from conception kind of stage. That we have different programs that could be tailored for these different kind of groups. But in terms of percentage, I would say probably 98% of our the business we're serving are small company, small and medium-sized company. It depends on the definition of SMEs, or but it's definitely the vast majority. So to a certain extent, the whole system or the whole WTCA ecosystem was set for smaller companies instead of bigger ones, because bigger companies they have tons of their own resources, and for them control is probably even bigger deal than additional resources. That's what we experience. But the ecosystem for a lot of WTC operation is that there are major companies they want to leverage our operation, WTC operation, as a channel to help these local small and medium-sized companies eventually to have a supply chain together, ecosystem together, because they have big stake on that. So go back to how we can work with our WTC operations, such as AMTZ, to help a small and medium-sized company. I think there's so many things we do. We have this in addition to international global connectivity. We also have international trade service system, which will offer many services such as exhibition, trade show services. We offer matchmaking services. We offer trade mission services. We offer corporate training services. We bring in knowledge, talents, and expertise to enable our World Trade Center operation and slow them to enable these small and medium-sized companies. They're lacking of resource, but they have the passion. They also have the aspiration, and there's a future. I mean, they grow. All the companies are at some point they're startup, they're small, right? So some of the startup eventually they will become a major company, such as Google, such as Pfizer's, right? But we feel like we are in a position to help them to grow and help them to really gain market access without that so much from their own resource. For example, we could really work with WTCA, AMTZ. We will work with Dr. Sharma's team to develop some of their corporate training program on how to leverage FTA for small and medium-sized companies in MedTech industry. We could also have a country-specific destination in this training program. For example, one training program could be targeting UK market, and another one could be target Australian market, for example, French market, and we can bring our local WTC operation in these destination countries together as part of their talent pool for this corporate training development. This is just one of example I thought about, and we would be very, very willing to do.
Fantastic. And Dr. Sharma, again, just extending this particular conversation, when there's startups, and when I went and visited AMTZ, I saw how the young people were being incubated, or they were using the labs to try and create some stuff. Now, when we look at an agreement between WTC and AMTZ, these smaller companies look at AMTZ to get this support through WTC. It is not directly that they are looking at it. How do you think AMTZ can reduce two things, the capital expenditure and the compliance risk for a startup that is looking to try and go global? How does AMTZ help through this relationship?
So, capital expenditure reduction comes from infrastructure support. That's the job and mandate of AMTZ, not just as a member of WTCA, but also as a technopark. After all, the concept of shared services comes from ability to reduce cost when shared infrastructure is not a burden to small, medium-sized companies and startups. That's what we have done in almost every single 178 companies that we have today, we have done for them. Compliance risk reduction comes from knowledge. And knowledge is directly proportional to your market. So when you're selling in India, your knowledge is Indian. When you're selling in South, your knowledge is encompassing Sri Lanka, Singapore, and so on. When you are selling in Asia, you must learn the knowledge, compliance knowledge required in China, Korea, Japan, and so on. And therefore, as market access boundaries expand, knowledge has to proportionately expand, for which we need knowledge partners. And therefore, we should not always think World Trade Center Association as a business partner. It's also a strong knowledge partner because it's directly proportional. Knowledge leads to business, and business demands more knowledge. And in this journey, it's also a journey of self-learning for startups. They end up learning what they didn't even know exists. Also, some newer dimensions where, and I feel always, Mr. Narula, when you are alone, you are powerful. When you are with me, we both are more powerful than what we are individually. When we are with Mr. Scott, three of us are more powerful than each of us can be independently, right? And therefore, whenever a group of wonderful people, organizations gather, we must endeavor to find solutions that individuals have not been able to find. For example, newer technologies in electronic waste. People are struggling, right? We have an electronic waste management plant where we actually extract a whole lot of precious elements from electronic waste. Our ability to reach out to other electronic waste producers, extractors from all over the world, the single answer would be WTCA. Our ability to reach global small and medium enterprises would be WTCA. Our rare earth discussions would be WTCA. And therefore, if there is a lot of traffic on one road, you take a flyover. You don't kill everybody on the road. You actually take a flyover and bypass the traffic. And to me, that power to bypass the traffic of congestion in science, business, and knowledge is through institutional memberships of large fraternities like WTCA, where institutions like AMTZ brings along hundreds of startups, medium-sized companies along to take the benefit of the highway. And I'm sorry for my examples.
No, this is so easy to understand when you speak like that. It is amazing. Mr. Wang, are you seeing or sensing an increased interest from the European or UK investors in Indian medtech following these FTAs?
Absolutely. Even before these FTAs, the momentum was already there for quite a long time. India has a great foundation for the medtech industry and the pharma industry. That's quite well known in Western world. And also, their theme today is really about diversification. So there's, the security, the safety of the supply chain. So for all these major markets and countries, they're actually looking for alternative source. In this sector, India is either positioned as itself as a major farmer and medtech base. At the same time, it also positioned as an alternative base. So if you combine the two together, the momentum is huge. The interest is real, is genuine. To me, I think it's really the question is for India how to leverage, how to really make sure that these investment can land in India efficiently and promptly because the competition is there for this type of investment. Everybody will try to get a piece of it, right? So I do think that the WTCA AMTZ set up a great example by this integrated ecosystem, by this high quality operation and services. Because I visited there, when we talk about small and medium-sized company, I saw incubators there, right? I saw this shared testing facility there. So for example, if you testing, for small and medium-sized companies, there's so many things that you need to prepare, for example, quick paperwork, compliance thing, right? But in this industry park, is a park you can get hands-on, you get the team in front of you. They will basically, you don't really need to know everything yourself because they will basically, will help you get through the process and get the results. That's what I saw. And it's so encouraging. So I think WTCA AMTZ could have become a wonderful access point for foreign direct investment from Western countries to India to capitalize this great opportunity because the ecosystem is there. Not as you said. I visited a lot of India cities and in this industry park and manufacturing base. I was truly impressed by AMTZ for sure.
Fantastic. Dr. Sharma, let me make this little wider perspective. If India wants to become a trusted global manufacturing hub, what three capabilities must manufacturers build over the next 5 years to make this vision a reality?
Yeah, I think a very precise question. The three non-negotiable pieces would be: one, product quality. Particularly in MedTech, where in my hand you can see a pacemaker. We make this, it goes inside the heart, keeps it beating. If this quality is not good, the heart wouldn't beat. Non-negotiable first point would be product quality. The second would be an internationally coherent communication strategy. Because our ability to communicate might be different and in different manner than the rest of the world. And that's why all of us are unique. But we must have an internationally coherent communication strategy about our business. And the third, which leads to trust and credibility, is lesser lead time to deliver. You may deliver a great job, but if you take 3 years to deliver, that's not what customer wants, because there is an opportunity cost of money, there is a lost business, there is a competition threat that comes in during those 3 years. So quality, communication, lead time would be 3 things that should be the pillars to take advantage of a global growth.
And Mr. Wang, if I'm correct, WTCA is hosting the Global Business Forum. Actually, it is going to be hosted by WTC Philadelphia, uh, which will spotlight life sciences specifically in 2026. What opportunities do you think you'll be able to create for Indian medtech firms to prepare so that they can prepare for this forum, and what is the value for them to be present there, sir?
Yes. Well, thank you for this question, GBF question. First of all, the Global Business Forum is our signature program. It's annual. It rotates in major continents, major region, and countries. We had 2 years ago we were in Bangalore for this. Last year we were in Marseille, and this year is in Philadelphia. The one thing with Philadelphia is that Philadelphia has a robust MedTech, biotech community. The ecosystem is there. There is quite a lot of companies that are very competitive, even in the world stage. So the organizer, basically the WTCA and the WTC, Great Philadelphia, we work together to create a sector kind of focus sector kind of session, which is have focus on life science biotech sector. I do think that is very, very relevant to our topic today, right? During our conference in Philadelphia, we'll do kind of sector-focused matchmaking services for companies to make it easy for companies to find the right partners. And also we will have speakers and panel discussion regarding market intelligence regulations on this sector. I do believe that companies in life science in this sector from India and other countries can benefit from this program greatly. I look forward to working with Dr. Sharma to organize a big delegation from AMTZ with all these, because of the B2B opportunity, we have to get a company to participate to leverage to get the benefits.
Fantastic. My next question is to both of you. And the reason I want to ask you the same question is because I want a global perspective as well as somebody who's already a part of the ecosystem in India, that perspective. India's medical device industry, we are projecting it to be a $50 billion industry by 2030. What must India get right? And I want a very honest answer for this, that what is it that India must get right to realistically achieve this vision that we have set for ourselves? Scott, what do you think we should be doing? And then Dr. Sharma, what do you think we should be doing? You're hardcore into the system.
I think, let me go first. I think, and to be brief, I think the keyword is ecosystem. How to build up an ecosystem that can make foreign investment interest to put the money in India, the ecosystem, how to really help the startups in this industry to grow, the ecosystem, how to streamline the process for these manufacturers to really gain the efficiency, reduce cost, be competitive in the international marketplace. And everybody needed to chip in this process. The government, the WTC, the local chamber, the company themselves, everybody will need to be part of the ecosystem. To work together to make things happen.
And I think, yes, I think the single most important in terms of life sciences medtech would be international harmonization and mutual recognition of regulatory norms. Because if we internationally standardize ourselves and we mutually recognize our regulatory norms with other countries, that would be the biggest encouragement to market access.
My last question to each one of you separately. Scott, what would be that one strategic message for global investors who are evaluating India as a possibility? Because now you've been on the ground in India, you visited AMTZ, you've been visiting India. What is that one strategic message that you'd like to give to a global investor who is evaluating India at this point in time?
If I give one advice to them, I would say do not hesitate. Why the opportunity is there? I know a lot of people are thinking too much, but there is no 100% kind of situation or perfect business environment there. While the opportunity is not just there, it's a great opportunity, great because I can tell that from our WTC expansion. Like we have, like India has been like the top two growth market for us, like in the past 5 years, even during pandemic. I mean, this is that if you wanted to get in India, this is a great opportunity and a great timing.
And Dr. Sharma, one piece of advice for an ambitious Indian medtech entrepreneur, not a company, but an entrepreneur aiming to export from India to the world.
We actually give two assurances. If you want to produce at AMTZ and you are hesitating, as Mr. Scott rightly mentioned, too much of thinking, too much of hesitation, we guarantee 50% of your produce with market access support. Whatever you produce, 50% leave it to us.
Fantastic. You know what? This conversation makes one thing very, very clear, that trade agreements may open doors, but it's actually the ecosystems that determine who walks through them. And Scott, you very, very correctly in your advice said that, ecosystems is what makes a difference. Now, with global platforms like World Trade Centers Association, the WTCA, connecting markets and innovation hubs like AMTZ, strengthening India's manufacturing and regulatory backbone, the opportunity before an Indian medtech is not just incremental. I think it is more structural in enabling this to actually see the light of the day. The real question is not whether India can compete globally. I think we are all sure about that. It is about how quickly can we align the capability, the capital, and the collaboration between the members to come together and lead this, to turn this into a reality. So thank you, Scott Wang and Dr. Jitendra Sharma, for sharing strategic clarity on what lies ahead for the Indian medtech journey. Thank you so much for joining us on BW Healthcare World.
Thank you.
Thank you.
Thank you, Mr.
Thank you. We look forward to talking with you next time.
Absolutely, yes. Sir. It'll be my pleasure.
And Dr. Sharma, it's always a pleasure speaking with you.